Hey everyone, today we'll be discussing the mechanisms of the acute inflammatory leukogram. So here's our example patient to just keep this in a clinical context. Couscous is a 3-year-old female toy poodle, and she presented with lethargy and anorexia of 2 days duration and occasional vomiting. Physical exam revealed a fever of 103.2 degrees Fahrenheit. She had moderate lethargy and anterior abdominal pain. Her mucous membranes, pulse, and respirations were within normal limits. So what I have here on the screen is the CBC data, and we're going to be focusing on the leukogram, which starts right here. And so we have this increased white blood cell count. So she has a leukocytosis. And the segmented neutrophils are also increased. So that leukocytosis is due to a neutrophilia with a left shift. So that's an increase in band neutrophils. Okay, and that is the hallmark of an acute inflammatory leukogram. And also, she has a lymphopenia, so a decrease in lymphocytes. So let's discuss why we're seeing those changes. So this image depicts neutrophil kinetics. So here we have the bone marrow, and the proliferative pool, maturation pool, and the storage pool. And so really what we're going to be focusing on are the maturation and storage pool movements. So within those, we have, remember, the metamyelocyte, band, and segmented neutrophil. If you're not familiar with the bone marrow pools, you may need to go back and review those. We also here have the blood vessel that depicts the peripheral blood, and then tissue. And we're going to talk about the movement between all those. So in health, neutrophils, the segmented mature neutrophil, moves from the storage pool into the blood vessel or peripheral blood, and then it distributes between the circulating pool, which is the pool which you collect blood from when you collect blood from your patient, and the marginating pool, which is not represented in the blood when you collect blood. The neutrophils will then bind to the adhesion proteins and then migrate into the tissue where they perform their protective functions, and then they die. In the acute inflammatory neutrophilia, the neutrophilia occurs because the release of neutrophils from the marrow exceeds the migration of those neutrophils into the tissue. Okay, so we have a few migrating. We're going to add in some adhesion molecules. So the neutrophils that are entering, some will attach to the adhesion molecules and then migrate. But again, the majority are staying within the peripheral blood. Once that storage pool is exhausted, then bands start to be released if the inflammatory cytokines are still calling for more neutrophils to do their job and fight this inflammation. Okay, so we're getting some are going. Of course, some of these then are dying that are at the inflammatory site because they may be killing some bacteria. And then there is a call for more neutrophils. Once the bands are then exhausted, you'll start to see the metamyelocytes enter the blood as well. So that left shift is created by the release of the banned neutrophils and other immature neutrophils from the maturation pool. That explains the mechanism of the leukocytosis due to the neutrophilia and left shift seen in our patient couscous, as well as the typical acute inflammatory leukogram in general. Okay, so now we're going to talk about the lymphocyte kinetics, and ultimately we want to explain why we saw and why we actually expect to see a lymphopenia in an acute inflammatory leukogram. So first, just to go over this diagram, what we have here, there's the blood vessel, and within the blood, the lymphocytes are distributed between the circulating pool, which is the population that is represented when you take blood from your patient, and the marginating pool, which is not represented in the blood sample when you take blood from your patient. Okay, lymphocytes are long-lived cells, and they recirculate many times, and they'll go into the smaller vessels, into the non-lymphoid tissue, enter the afferent lymphatic vessels, spend some time in the lymphatics, and then leave, and then go back into the blood again, and they can do that multiple times. In the acute inflammatory response, there are two major reasons for the lymphopenia. First, there is increased migration of the lymphocytes to the site of inflammation. And second, the inflammatory cytokines stimulate lymphocyte homing, or for the lymphocytes to travel back to their tissue of origin. Decreased migration of lymphocytes to the blood is also occurring, but this is a less important mechanism in the acute inflammatory response. So that's it. So now you should be able to explain why in an acute inflammatory leukogram, the most typical form, we expect to see a leukocytosis due to a neutrophilia with a left shift, and that is the most important clue there. The left shift is the hallmark of the acute inflammatory leukogram, and there is also expected to be a lymphopenia. So I hope that helped. Thank you. Bye-bye.